Hi there, it's Mary-Louise from Pre and Postnatal Yoga. I teach at Key in Sydney. This is Harriet, who is 39 weeks pregnant. And if you've just joined us for this particular video, we're winding down after doing just a little bit of stretching. We're now going to do a little bit of gentle breathing and then come into relaxation. Now Harriet's sitting cross-legged, but if you had any pelvic instability, your legs would be out in front. Of course, not taking your legs any wider than hip distance apart. But Harriet does not experience any pelvic instability, so she's okay to sit cross-legged. Now the thing that we've talked about, and you've probably realised if you've done any pre or postnatal training with yoga or with your midwives or with your doula, is the importance of the deep diaphragmatic breathing during labour. It will not only help you during vaginal delivery, but also epidural or C-section. It activates the parasympathetic nervous system, which helps to keep you and your baby calm, as distinct to sympathetic nervous system, which is breathing into the chest, short, shallow breathing, and that is your fight-flight response. So if you find yourself doing that in labour, getting a little bit short of breath and a little bit panting or frightened, deepening the breath is important. But sometimes that's a bit difficult to do. So we've got a little cheats way of helping you to breathe diaphragmatically. So we're going to tuck the thumbs in and the fingers over the thumbs and just rest the hands down. Now Harriet doesn't have to do anything. Because she has done that, the meridians, the natural meridians in the body, will force the body to breathe diaphragmatically. So diaphragmatic breathing, your diaphragm is really working there to breathe in and out. So if you become panicked during your labour, you simply tuck your thumbs in. Now let's test that theory out. We'll bring the thumbs out and the fingers outside. So thumbs are on the outside, fingers in. And the breath will move up to the chest. And again, you don't have to do anything. The body will naturally do it. You don't have to think about it. It will happen. The only time we would want to breathe into the chest during your labour, and you need to listen to your midwife or your doula, of course, but it's usually in second stage when you're in transition and you need to move into that pant, pant, blow stage. But otherwise, it's this deep diaphragmatic breathing that we're using for the majority of labour. So we'll just show them again there, Harriet, tucking thumbs in, fingers over thumbs. This is the one you want. So when you're practicing your deep diaphragmatic breathing, it might be wise to use this, what we call in yoga, a mudra, a hand gesture, to help direct the breath. And then releasing the hands. And we're going to ask Harriet now to lie down, ready for relaxation. When you are pregnant, if you're over 21 weeks, you must lie on your left side. This is to prevent any pressure on the vena cava. So we don't want any pressure on that big artery. So you lie on your left with a bolster or a cushion, and we want it as high as possible so that the knee is fairly level with the hip. And the ankle is supported as well, particularly if you have any fluid retention in your ankles, which tends to happen towards the end of your pregnancy. You'll notice also Harriet's head is well supported. It's best not to have your head flat down or too high with a pillow, which will just cause a neck problem. The key to relaxation is making sure that you're supported and comfortable. So in this position, we're first of all releasing any tension in the body. You can do a little tense and release. You can tense your ankles and then release. Tense your buttocks and release. Tense your shoulders and release. Open your mouth, have a lovely yawn. Oh. Make sure your jaw is relaxed, your eyes are relaxed. Simply lifting the eyebrows up helps to relax any tension, and then relaxing the eyes. And say to yourself, I am now going to relax. Baby, everything's okay. Mum is now going to relax. And this is so important, not only prenatally, but postnatally, to get as much rest as you possibly can. We'll work through the body very gently. So bringing the awareness to the right side of the body, right thumb, index finger, middle finger, ring finger, little finger, back of hand, palm of hand, wrist, whole right hand, lower arm, elbow, upper arm, shoulder, armpit, whole right arm, right side of chest, waist, hip, buttock, top of right leg, knee, lower leg, ankle, top of right foot, toes, sole, heel, whole right foot, whole right leg, whole right side of body. Awareness to left side of body, left thumb, index finger, middle finger, ring finger, little finger, all fingers, back of hand, palm of hand, wrist, whole left hand, lower arm, elbow, upper arm, shoulder, armpit, whole left arm, left side of chest, waist, hip, buttock, top of left leg, knee, lower leg, ankle, top of left foot, toes, sole, heel, whole left foot, whole left leg, whole left side of body. Awareness to back of body, both heels, calves, knees, buttocks, lower spine, middle spine, upper spine, shoulder blades, back of neck, back of head, whole back of body. Awareness to top of head, forehead, right eyebrow, left eyebrow, right eye, left eye. Eye gaze looking inward as baby looks up. Mother and baby's eyes meeting. Soft, gentle, loving gaze. Right temple, left temple. Right ear, left ear. Right cheek, left cheek. Right nostril, left nostril. Lower jaw, tongue. Whole of face, flesh of cheeks falling away from cheekbones. Whole of head. Throat is soft, chest, lungs and heart relaxed. Baby safe and warm inside the womb, feeling the gentle rhythm of mother's breath as the body breathes in and as the body breathes out. Safe, warm, content. Awareness to groin, pelvic floor, sacrum, hips, whole of pelvis, thighs, knees, shins, ankles, toes, whole front of body, whole back of body, whole physical body, completely still and relaxed. And as the body relaxes in stillness, the conscious mind can release, control, and simply observe this body as it breathes in and breathes out with no effort, no control. Allowing mother to visualize baby inside the womb, floating completely weightless in beautiful golden orb of light. And visualize mother too, curled in fetal position, also in this golden orb of light, hugging baby to chest and belly, smelling, touching, feeling baby's newborn soft warm skin against mother's naked breasts and belly. Mother and baby both in fetal position, both in a beautiful golden orb of light, both feeling the gentle, reassuring rhythm of breath. Visualize now a beautiful golden thread extending from mother's heart center to baby's heart center. The golden heart umbilical cord that is never cut between a mother and child. Let go now. Let go. Allow the gentle breath, the rhythm of life force, to nurture this mother and child. Letting go. Completely at peace.